My name is Steve Kozub, 48 years old. I'm a successful patient of maggot therapy. No doubt you've put this video in right now. You're at the end of the road, like I was. And I'm here to tell my story so you won't be so reticent or apprehensive about getting maggot therapy. I have quite a story, so if you want to listen to the story, I'd be more than happy to share it with you. I had knee replacement surgery in December of 2000. In the ensuing weeks after the surgery, my leg became infected. The infection was unaddressed by the attending physician. Consequently, the wound kept weeping and draining, and I was languishing with a problem that I didn't know how to correct. I got out of this doctor's care and went to another doctor at St. Joseph's Hospital. They took the knee out, the replacement out, and they put a cement spacer in place of the knee replacement because they had to cure the infection that had gotten to the bone. I went through a series of tests, radioactive tests to prove or to find out if the infection had gotten to the bone, and it did. So they had to put me on a 6 weeks course of vancomycin, which is a very strong antibiotic. So I went through this for 6 weeks and eradicated the infection. I went for 9 months on crutches before they put the new replacement in. The new replacement was done approximately November of 2002. My leg had swollen up so badly after the third surgery, when the replacement was put back in, that the staples were not able to, the skin was not able to handle the staples holding my skin together. Consequently, I developed tunneling holes in my incision after the third surgery. They put me back in the hospital and did skin grafting off my hip and put it on my kneecap and relocated part of my calf muscle. And here's where the story begins with the maggot therapy. The skin grafting died. About 50% of it was wasting and turning necrotic, which is, you probably know right now because you're languishing in your own personal problem with your wound, that it's necrotic tissue, it's black, and it's dying. And it's a perfect breeding ground for infection. I was despondent. It was a Saturday night. I'm watching the Discovery Channel. And on comes this program about maggots and leeches and bees. And one of the vignettes was regarding my situation, which was a wound that won't heal. Meanwhile, the plastic surgeon was playing around with my necrotic tissue and trying to manually debride the wound. Well, it wasn't going anywhere because he was doing it once a week, and it was just getting worse. After seeing the program, I was convinced that maggot therapy was the way to go. As I said, this was my fourth surgery. I even asked the doctor if he can cut my leg off because I was just, after 4 surgeries in 1 year, I was completely despondent. I had been through enough intravenous antibiotic therapy to just get me totally disgusted with the whole thing. I'd rather have my leg cut off than deal with this. Well, the doctor said no, that the maggots would work. I went into Hoag Hospital, and I had 2 3-day exposures to the maggots. The therapy was painless. The maggots were contained in a specific area where the wound was. They did not get out of the bandaging. They did not cause me any kind of irritation whatsoever. I couldn't even feel them doing their work. The only thing that was a little disconcerting was when you change the bandages, because they do weep, because they excrete a methane type of an odor. Their excretions smell like methane because they're eating necrotic tissue, your necrotic tissue. When you take the bandages off, because it's weeping more and more as they mature, the site is a little disconcerting because they've grown and they've matured and they are in this contained area and they're moving around quite rapidly and feasting quite rapidly. And voraciously, to the point where I actually called the nurse and I asked the nurse, are they going to eat fruit on my bone? And she said no. She said they'll be fine. They only eat necrotic tissue. They do not eat clean tissue. They will eat all they can eat of the dead tissue. When the dead tissue is no longer there, they will not eat any clean tissue whatsoever. So at the end of the second treatment of maggot therapy, they peeled it off, and they didn't take it off all at one time. What they did was they peeled it off gently and removed the maggots as they were peeling off the dressing. Once the dressing was removed, there was clean, virgin tissue. It looked like I had just scraped my knee. There was cavities in the area that the maggots had eaten out all the necrotic tissue, and that cavity was clean, pink, and didn't look anything like it did 6 days prior, before the maggots. And as I said, for a 3-week period after I had the skin grafting and the grafting was dying, the doctor was playing around with it. He was just removing little bits at a time, but more necrotic tissue was developing because there wasn't a blood supply. Well, the maggots created a blood supply. And I also learned that the maggots excrete a fluid that creates a natural antibiotic, and it's 100% effective and does not allow any breeding ground for any infection. Well, that's what sold me on it, and that's why I had it done. And today, I was able to keep my leg. If I had to do it again, I'm looking forward to it. And that's about what you should be doing right now. You should turn off that VCR. You should tell the doctor this is what you want to do. Because the alternative is amputation, and you don't have to go through that. Don't sit there any longer and wonder if I should do this or what it's going to feel like. You're not going to feel a thing, and chances are someone else is going to change your dressing for you while you're in the hospital. But if you have to change your dressing, it's not a big deal. It's just a little, you take a video camera and video it because you want to show people what the maggots look like in their breeding ground when they're on your wound, because it is a see-through, ventilated nylon mesh. And you will want to keep this for your kids and your grandkids and have them laugh about it over Christmas, after Christmas dinner. So get it done. You won't regret it.